When individuals are considering losing a significant amount of weight, I think one of the most common things that I see that I think as medical providers, we don't always do the best job of addressing at the forefront. Honestly, because when someone is finally committing to a health journey that is going to be a long-term journey, I think our focus should be on really the positives and focusing on rallying behind our patients to provide them with the support they need. But one thing that I note when I see my patients back for their 1-year follow-up, their 2-year follow-up, and we've been working together for a long time, sometimes patients will hit a point where their weight plateaus. And it's interesting for me because I can start to see signs that a patient might be not as comfortable in their body as they were before. And those signs to me are when a patient's not doing as much as they used to with nutrition or not doing as much with physical activity, and they just seem to be a little bit complacent about their change. When I start to see that, that allows me to really try to open the door and ask my patient, is there some reason why you're not necessarily interested in losing any more weight? And what I'm really trying to get at is for patients to start to acknowledge that they're in a completely different space in their life than they've ever been. Maybe they've been this weight before, but the last time they were this weight was maybe before having 2 children, or maybe it was when they were in college. So many other factors are different. And again, one of the things that we know with excess weight loss is there is going to be excess skin. And so for patients, again, especially with aging, and we know the changes in elastin and collagen, that skin may look different than it did at a lower weight if someone was at a lower similar weight before in their life. So being able to, first of all, acknowledge that this is all expected, and also being able to normalize this and acknowledge this with patients that not only is it okay to be in this place, but it's also totally okay to not be happy with it and not be satisfied with it, and having stronger emotions, or honestly having that cognitive dissonance of wanting to lose more weight but maybe not wanting to be in a completely unfamiliar place or space in your head or body is an absolutely normal thing to feel. And having a medical provider that's not only aware of that, but that's also prepared to help you engage with whether it's a therapist or a support group to really begin to start to explore what this chapter looks like for you is very important.